Good evening, sir. What brought you to the hospital today?
It is my emphysema. It is acting up again. I tried my nebulizer and some steroids, but it is still hard to breathe.
Well, let me get Dr. Spencer to help you. She will be right in.
Hello, sir. I am Dr. Spencer, the emergency department doctor. I would like to ask you some questions and examine you if that is okay.
Of course. I hope you can help my breathing. Last time this happened I was in the hospital for 2 days.
Well, I think you need to stay in the hospital. Let me call Dr. Tierney. With aggressive treatment I think you may be able to go home tomorrow, so we will start with observation.
Good morning, Dr. Tierney. It was a rough night. I needed treatments almost every hour and it is still hard to breathe.
Well, Mr. Schroeder, you are still not moving air very well. I had hoped you would be able to go home, but you are not ready. I do not understand these new Medicare rules, so I am going to call Dr. Safferlo. There is something about counting midnights, but I am a doctor, not an accountant. Hi, Mark. Can you come up to the 4th floor? I have an observation patient that is not ready to go home.
Hi there, Jill. This new 2 midnight rule is confusing to some people, but it really is pretty easy. If your patient spent 1 midnight on observation and they are not safe to be discharged and need at least 1 more midnight in the hospital, then admit them, but please be sure your note indicates why they're not stable for discharge. Remember, the standard is whether they can safely receive the care they need in a lesser setting.
It is that easy? If they are not stable to go home or to a nursing home, I should admit them? What if I think they are going to be able to go home the next morning?
If they need to be in the hospital past that 2nd midnight, Medicare says you must admit them as inpatient. Keeping them observation violates their rights. Now, if they're feeling better but they do not have a ride home or do not want to drive in the dark, then you would not admit them. Keep them observation.
Well, what if the patient is not safe to be discharged home, like the elderly patient who is falling and can no longer live alone? Should I admit that patient?
Well, the patient does not need to be in the hospital. They could live at home with an aide or a nursing home. Ask the case manager for help, but do not admit.
Well, this really is pretty easy. And if I think they will need more than 2 midnights when they first present, I should just admit them as inpatient right away?
Exactly. But be sure your note explains why you think they will need to stay that long. Point out all the abnormal labs and vital signs on your plans. One more thing. If you admit them as inpatient and they get better faster than you expected, put a brief note in the chart saying that. A few words will help us avoid a denial.
Well, Mark, thanks for the explanation. If any of my notes do not clearly justify why I am keeping my patient in the hospital, please call me. Now let me go write Mr. Schroeder's inpatient admission order since he needs another midnight in the hospital.
This new rule really is pretty simple. The overriding message is that doctors need to document what they're thinking and what they worried about. Medicare does not want to pay to hospitalize patients that do not need to be in the hospital, and they should not. The doctor's notes help show who needs to be in the hospital. Patients may want to stay an extra night because it seems too late to go home or they are lonely at home, but that is not a medical reason to stay. Please do not be afraid to ask for help. No one is questioning your medical care. This is all about getting the patient in the correct status. Thanks for listening.